Hi, my name is Madeline Silva, and this is the campus construction site scenario for KIN 241. So what we want to start off by doing is going and assessing the scene. So this includes looking out for potential hazards. So in this case, it would be the saw that severed the man's leg. And then we want to take note of any bystanders. So we want to look out for who can help, such as calling 911, or who can help assisting me. And then we want to look out for anybody we want to move, either to get to the patient or to get them out of harm's way. And then next, what we want to do is we want to go ahead and assess the patient. So this can include the patient's level of consciousness and their responsiveness. So we can check this by asking them questions like, how are you doing? Like, how are you feeling? Anything like that. By asking these questions, we can determine more of their state of mind, such as like, are they in an early stage of shock? How are they responding to these questions? How are they dealing with this trauma? We also want to assess the severity of the bleeding. So this could include like the type of bleeding, such as arterial, venous, or capillary. I would assume it would be an arterial bleeding, seeing as that's the most severe type of bleeding. Next, we want to move on to ensure our safety. So this includes ensuring we have on PPE, or personal protective equipment. So this can be things such as gloves or masks. We have to keep in mind any bloodborne pathogens and make sure we correctly equip ourselves. So the next thing we want to do is go ahead and try and control the bleeding. So the best way to do this in this scenario would be applying a tourniquet, seeing as the leg was severed completely. So we want to do this by making sure that the tourniquet is 2 inches above the wound and not applied over a joint. And before we go ahead and apply that tourniquet, we want to make sure that we keep the patient calm. We want to check in on them, comfort them, explain why placing this tourniquet is necessary, and warn them that placing this tourniquet will cause them an extreme amount of pain. Once we place that tourniquet, we want to make sure we take note of the time. That way we let EMS know what time the tourniquet was placed. So next thing we want to do is, once we ensure that the patient is doing okay and the tourniquet was placed properly, I or somebody else that I will direct is going to turn their attention towards the severed limb. So what we need to do in this case is wrap the leg in a sterile gauze, and if we have sterile saline available, we want to moisten that gauze, and then we want to put the leg in a bag and label it with the name of the patient, the time, and the date that it was placed inside the bag. So once we do this, we want to make sure we keep the bag in a cool area until EMS arrives and we hand it off to them so they can take proper care. Okay, one of the last things we can do is just to continue monitoring the patient until further help arrives. So this can include keeping track of their level of consciousness and their responsiveness. This can include just communicating with the patient, like asking them frequent questions to make sure they're still doing okay. We can check their vitals, such as their heart rate. Another thing we could take a look at is whether they look clammy, whether they look pale. We also want to take note of their ABC. So this is their airway, their breathing, and their circulation. We want to make sure they're doing okay until further help arrives.